Good morning. Welcome back to Open Med School. The last session we have discussed about the stepwise approach to arterial blood gas analysis. Today, the focus is on the rules of compensation for respiratory disorders. So let us start. So first step is look at the pH, identify whether it is acidic or alkalotic. So here you can see the pH is 7.25. So that means the patient has got a acidemia. Now we look at the PaCO₂. So here the PaCO₂ is 35.3. The normal is 35 to 45 and the middle value is 40. So this cannot explain the change that has occurred. So now we look at the bicarbonate. The bicarbonate is 14.9. So the bicarbonate normal is 22 to 26 and the middle value is 24. So here you can definitely see that the bicarbonate is decreased. So here the problem the patient has got a pathological process is the acidosis. Acidosis is due to metabolic. So it is a metabolic acidosis. So we have looked at the pH, then we looked at the PaCO₂, then looked at the bicarbonate or the metabolic component, and we matched the pH with this metabolic and respiratory component, that the bicarbonate and PaCO₂, and found that the patient has got a metabolic acidosis. So whenever there is a acidosis or alkalosis that is occurring, the body will make some compensation. For example, a patient with acidosis means there is excess of hydrogen ions. The carbon dioxide combined with water produces carbonic acid, which dissociate into hydrogen ions and bicarbonate. So whenever there is excess hydrogen ions, the AC way will be a respiratory compensation. The respiratory compensation occurs within short time, within minutes, and will be complete also fast. By 24 hours, 12 to 24 hours, the compensation, especially in acute cases, will be complete. So what is the compensation occurring in respiratory acidosis? In respiratory acidosis, the PaCO₂ is high. So what will happen? The body will try to increase the bicarbonate. The metabolic component will be increased. So in respiratory acidosis, the bicarbonate will increase. Hope the understood the point. Suppose it's a respiratory alkalosis. So what is happening? The carbon dioxide is washed out. So PaCO₂ is low. So what will happen? So body, there is increase in bicarbonate. So bicarbonate will come down. So in respiratory acidosis, the bicarbonate compensated, it increases. And in respiratory alkalosis, as a compensation, the bicarbonate comes down. Now take the metabolic component. When there is a metabolic acidosis, for example, there is ketoacidosis. What is happening? Excess hydrogen ion is there. So what will happen again? The body will wash it out. So that is why you get the Kussmaul's breathing, the hyperventilation that occurs in the acidotic breathing. Suppose the metabolic alkalosis, what will happen? In metabolic alkalosis, the bicarbonate level is increasing. So what the body can do is increase the carbon dioxide or PaCO₂. So this is what is called the compensation or the secondary changes that is occurring in a patient with the acid-base disorders. So now the next step will be check for the compensation rules. So in next session, I'll be discussing about the compensation occurring in respiratory disorders, followed by the compensation occurring in metabolic disorders, and just to give a brief outline about the rules now. So let us look in the rules of compensation. It is a little difficult to remember it by heart. So after the next session, by practicing, you'll be able to remember it easily.